Hello everyone, I hope you're fine and welcome back to my channel. In this video, we are going to discuss about Juvenile Rheumatoid Arthritis or the Still's disease. Now, the JRA or the Juvenile Rheumatoid Arthritis is also known as JIA, that is a Juvenile Idiopathic Arthritis, and is basically a chronic autoimmune disorder that primarily affects the children and adolescents. It is characterized by the persistent joint inflammation which leads to swelling, pain and stiffness. Now let's talk about the symptoms. So the symptoms of the JRA can vary from mild to severe. And as you know that there are different subtypes of the JRA, so different subtypes of the JRA can have slightly different symptoms. But the common to all are joint pain, swelling, stiffness, and the limitation of movement. Fatigue, fever, rash are also common symptoms. Now the joints that are most commonly affected are the knee joints, wrist joints, ankle joints, and the small joints of the hands and feet. Now, let's see what are the several subtypes of the JRA. So, there are several subtypes of the JRA including number 1, seropositive polyarthritis, that is adult type occurring in children. So, seropositive and the seronegative polyarthritis are the terms used to describe two different types of polyarthritis based on specific serological markers. And these markers are antibodies present in the blood that can be detected through the laboratory testing. So, in the seropositive polyarthritis, specific autoantibodies called the RF, that are the rheumatoid factors, and the anti-CCP, these are the anticyclic citrullinated peptides. So these antibodies are present in the blood. And this type tends to have a more aggressive disease course and is often associated with more severe joint involvement. Then we have the classical Still's disease, which has three subtypes. Number 1, with the systemic manifestation. So it is going to have systemic symptoms like the fever, fatigue, rash, in addition to joint involvement. Then the second subtype is with polyarthritis. It means that it is going to involve 5 or more than 5 joints. Then the third subtype is with the periarticular arthritis. That is, the word peri means around or surrounding. Articular means the joint itself. So it means that this type of arthritis is going to involve the area or the structures that are surrounding the joint, like the muscle, tendon, ligament, bursa, fascia, but with a minimal joint involvement itself. Then the third subtype is the seronegative polyarthritis with the sacroiliitis. Now, here the antibodies like the RF and anti-CCP, they are absent. And this type often involves the axial skeleton, especially the spine and the sacroiliac joint. Then the fourth one is arthritis associated with psoriasis, ulcerative colitis, and the Crohn's disease. So this type of arthritis occurs with involvement of other systems. Like in the integumentary system, there can be a psoriasis, or in the lower GIT diseases, we have the ulcerative colitis or the Crohn's disease. So arthritis is going to occur with the involvement of these systems. Now, these subgroups differ in age of onset, gender, course, complications, and prognosis. So let's take a view how they're different. So starting from the first type, that is number 1, seropositive JRA. It is same as that of its adult type. It has an onset in the late childhood and is more common in girls. Second one is the classical Still's disease. The onset of it is in the early childhood. Now its subtype is the systemic type, which presents with a high spiking fever, that is the swinging pyrexia. Then it can also present with the lymphadenopathy, the enlargement of the lymph nodes, splenomegaly, enlargement of the spleen, in addition to joint involvement. And this joint involvement can occur simultaneously or later on. Now, let's take a look on our next point before moving to prognosis. So our next point is seronegative disease with the sacroiliitis. And this is more common in the boys, unlike seropositive type, but like seropositive, it has its onset in the late childhood. And in the early adult life, it may lead to ankylosing spondylitis. Now, let's discuss the prognosis of it. So the outlook for the children with the JRA varies. It means that some may experience the occasional flare-ups followed by the period of remissions, while others may have more persistent symptoms. With proper treatment and management, children with the JRA can lead active and fulfilling lives. So overall, the prognosis is favorable, but the periarticular disease can be complicated by the iridocyclitis, that is an inflammation of the iris and ciliary body, and this requires a steroid therapy. Now, let's talk about diagnosis. So, diagnosis involves thorough medical history, physical examination, and laboratory testing. Imaging studies such as X-rays, MRI, they may be used to assess the joint damage. The diagnosis is based on the symptoms, duration of the joint inflammation, and exclusion of the other causes. Now, most patients show a positive test for the HLA-B27 antigen, and the clinical presentation of these patients resemble those of the ankylosing spondylitis, Rita's disease, ulcerative colitis, and Crohn's disease. Now, the Rita's disease is also known as reactive arthritis, and it is a type of inflammatory arthritis that typically occurs as a reaction to an infection in the other part of the body. The classic triad involves joint pain, uveitis, conjunctivitis, and urethritis. Now let's discuss about the cause. So the cause of the JRA is unknown. It is believed to involve a combination of genetic, environmental, and immunological factors. And the family history of the autoimmune disorders may increase the risk. Now, let's discuss about the treatment of the JRA. So the goal of the treatment is to control inflammation, relieve pain, prevent joint damage, and improve the child's quality of life. The treatment plan is same as that for the rheumatoid arthritis in the adults. So, in the first instance, we rely on aspirin, but if the treatment fails, we resort to NSAIDs. The corticosteroid therapy is not performed due to the side effects except for in complications like the iritis or the iridocyclitis. So now the general management plan includes the adequate rest, immobilization of the affected joint, physical therapy which includes the graduated exercise, and the surgical option when the fixed deformity is to be corrected or when the arthroplasty of the hip is needed. So that's all from my side. I hope you learned something from it. Thanks for watching.